So hey guys, this is Josh from SIBO Survivor, and I'm super excited to be joined by Dr. Melanie Keller today, an awesome SIBO expert and naturopathic physician. We're going to kind of dive into what is the migrating motor complex and why GI motility has such an impact on SIBO and IBS patients. I think this is one of the topics that a lot of people maybe miss in treatment or just something people don't understand. So I'm excited to kind of dive into this. But before we get started, just a little quick bio on Dr. Keller. So basically, Dr. Keller is a SIBO and IBS treatment expert. She's had rare postgraduate training in SIBO and continues to work with renowned professionals like Dr. Mark Pimentel, Dr. Allison Seebecker, and Dr. Steven Sandberg-Lewis. And now she has her main practice, SIBOsolution.com. So if anyone's interested in getting help, you can always go to her website and reach out there and find her there for more information. But I'm so excited to have you, and thanks for joining me, Dr. Keller.
Oh, it's my pleasure. Thank you for having me.
Cool. So just kind of diving into this topic. So I bet a lot of people have heard about the migrating motor complex. That term is thrown around a lot in the community, and I just wanted to kind of talk about it and help people understand, what it is a little bit better. So I guess the first thing is, what is the migrating? What is it? What is the migrating motor complex? And then we'll kind of get into more detail.
Well, so the migrating motor complex, we're talking about a certain section of the tube, right? So the tube is starting in our mouth and it's going to end up at the bottom, right? Yeah. So there's a certain section from the stomach through the small intestine where we're really talking about this migrating motor complex. There's 3 phases of it.
Yeah.
So I kind of use the example of your mouth and your chewing and your ability to swallow is kind of like you driving out from your home. And then the stomach and the small intestine is maybe, and a lot of people, because I'm talking to people in California, understand the 10, the 405, this analogy to getting into traffic, right? Mm-hmm. And so that's what we're basically seeing, is that there's certain things that can slow down that action. And so one example is someone who's eating all of the time or frequently, and this was a pretty common thing to be told to do, to stabilize your blood sugar, for example. Eat 4 to 6 small meals. Well, that's one of these things where it kind of just keeps putting cars into traffic. There's these little traffic lights, right? So it's like the frequency of you eating, or quite frankly even chewing gum, can stop this migrating motor complex action that we're talking about, because it's most active during periods of fasting, or the most active is when we're asleep. So we're fasting and we're sleeping, and that's when the migrating motor complex is moving everything down from the stomach / small intestine into the large intestine, where in the morning or when we first have food, so either upon rising or sometime thereafter, we put some food in, and there's another response that should let go of what's been in the large intestine / at the rectum, which is a different mechanism. But it's all about communication in the body.
Definitely. So I guess, people are probably wondering why is this important in SIBO and IBS? Like, what is the issue? Why do we need to do things to help this?
Well, we know from Dr. Pimentel's team that there's an association with, if you've had a food poisoning or traveler's diarrhea, your body could be reacting to one of the toxins that they leave behind, and that can give an immune reaction to a motor complex nerve. So to me, this is an absolutely fantastic discovery that they've made, and they've been able to identify that it's 99.9% sensitive and specific for somebody with IBS-D, but there must be other things that can trigger this as well. So there's a huge influx of people being mindful of gluten, say, for example, or dairy, casein, so there's little things that could be immune triggers to individuals that we don't know yet exactly, but they could be impacting the body in a unique way that's also hindering that action. But eating frequent meals is one that we really know of. We know that that's going to be slowing down that action, because that's where the light switches are in the body.
Yeah, definitely. And I guess the other thing that, I guess for me, I was a little bit confused about at the beginning, and for a lot of people, is like, what is the difference between, the migrating motor complex? That's kind of the term we're talking about, and that's what's important in IBS and SIBO patients, and other, functions like maybe the gastrocolic reflex, or just when people say peristalsis, right? Like, what is the difference between these?
Well, that is why there's the motility experts.
Yeah,
Okay, so I don't claim to be a GI
yeah,
motility expert, but I will say from observing at Cedars and from them going through, they're getting referrals right from other gastroenterologists who say this person is claiming they have a swallowing issue, so there's esophageal mammography. And so they're looking for this being different and electrical and via pressure. There's different reasonings for what could be happening from this part of the tube.
yeah,
Then there's different reasonings for the next part of the tube, which is the migrating motor complex section. And then that gastrocolic reflex is more in the large intestine, where we're looking for, does the body receive the information that food has come in? So you can actually even get a recto or anorectal like chest if you can feel the pressure, test if there's enough electrical. So those are typically the, kind of the algorithm that they'll do. If you're referred to a GI motility specialist, they're going to say, okay, is there something going on in the esophagus? Of course, this is based on someone's symptoms. Or is there something where, for example, they're not passing stool for days at a time? So they want to maybe find out. It's not very pleasant, but you have to find out in the rectum, like, does my rectum recognize the fullness of stool being there? Is there electrical circuitry that's saying, yep, okay, light switch on, let's get rid of this and let the sphincters relax, etc. And so those are things that when they rule those out, which is very common, like say, for example, I observed, I was just there for a week, but I could see, oh, okay, so you've looked at this, you've looked at that, and now they're saying the reasoning that it could be SIBO is higher now, or at least let's check for it.
Mm-hmm. Definitely. So I guess, how does someone know if, like, in what you've seen, like, do most SIBO patients have an issue with this? And how does someone know if this is an issue, right?
Yeah, it's an excellent question, because as a naturopath, I can't do these procedures, right?
Yeah.
So I would be referring and have referred to GI motility specialists. So some of you have been out there where you've been to the gastroenterologist and they've worked you up and down and they've said there's, i.e. nothing wrong with you, and it's IBS. That means that it's a diagnosis of exclusion. We couldn't find any other reasoning, which is again how it's being associated with, oh, is there something else going on? And we might as well run a breath test. They're pretty familiar with other breath tests, like looking for lactose, looking for fructose. Those are pretty common ones. And so now it's not as mainstream as everyone may like it to be, but it's getting there where there's more acknowledgement from, say, gastroenterologists to look with a lactulose breath test, okay? So, but as a naturopath, I may be looking at someone and saying, how many times have you done this? / how many years have you been doing this? And that's an indicator for me, for sure. And I have my tests that I run, but that's an indicator to me if my tests / they haven't been worked up by a gastroenterologist. They definitely should be, because we want to rule those certain things out.
Yeah, definitely. So yeah, basically, when you go to the gastroenterologist, there are certain tests they can do to kind of figure out if this may be an issue. Like, would you say in the IBS SIBO population, it seems to me like this is kind of one of the key factors that a lot of people miss when they do treatment, because sometimes people relapse. So what do you see as far as that? Do you see a lot of people who need work on this or help?
Sure. So here's an example of what we were just describing, right? Whether do I need to go and look for it, or what if it's already found and I got to deal with it?
Yeah.
So that's kind of, I see both of that, where I'll see somebody who is a patient of Dr. Pimentel's and they've looked at this and they say, yep, I am aware that I have this situation, right? That's unique to them. And so we have to treat their likelihood or their relapse potential or their current SIBO a different way. And it's very interesting because they're really tuned into it. They really know but they've also had all of the reasoning. They're like, oh, okay, this is why I feel this way. This is why it's difficult, for example, to maybe push or, eliminate stool fully, instead of that wondering or blaming broccoli, which I always, that's my little,
Yeah, definitely. So I guess that gets me into, what everyone wonders about, this topic is, what can be done to improve motility? Let's say someone, they've had the workups and it's pretty certain that they have an issue moving food and that migrating motor complex wave isn't functioning correctly. So what can someone do?
Okay, well, number one, and this is what I've been into for the last few years, and that is I look at an assessment of the stomach.
Yeah.
Because phase one of the migrating motor complex is emptying of the stomach, which is what erythromycin is doing. Okay, so there are, let's say it's 2015, I'll just put it that way. When I would prescribe erythromycin is after someone had a negative breath test and or they were reporting 75% or more improvement. Now, I will say this wasn't always necessarily by way of expanding the diet. Mm-hmm. In my opinion, I think it's a myth that you have to remain on a specific diet for the rest of your life or you're going to relapse.
Yeah.
That I don't know where that even, quite frankly, ever came from. However, are there certain foods and or awareness or looking at a food guide that could kind of say, this is how I manage my likelihood of relapse? Okay, so there were certain people who felt that much improvement and they would go on erythromycin. And typically and they would do well. They would do erythromycin for around 90 days. So this is someone who likely maybe hasn't had a food poisoning. And it's just like, this was what they found. This is what took care of it. And after even 90 days, they can even alternate to every other day, and they can eventually come off of this low dose, antibiotic that's not actually acting as an antibiotic. It's actually just emptying the stomach. Okay. Then there were people who that didn't necessarily work well for them, or they kind of teeter-tottered maybe the first couple of days, maybe the first couple of weeks. And those people may have done better with Resilor. Mm-hmm. And Resilor is a 5-HTP4 agonist, which is similar to ginger. I'll get to that. But this 5-HTP4 agonist actually helps give multiple migrating motor complex waves. So I forgot to mention that erythromycin is just going to empty the stomach, so we're going to get one wave. Okay. And Resilor, we're going to empty the stomach, and we're going to get multiple migrating motor complex waves. So that's one of the reasons why we actually encourage to take this at night during the time where it's most active. So those are the best or most well-known pharmaceutical medications. Then you can get into botanicals, and there's different combinations, but I specifically researched heavily the ginger, the chemical constituents in ginger, and those mimicked Resilor or 5-HTP4 agonists the closest. So that's the reason why I had found, but some people struggle with ginger. They get ginger burps. They get, they just don't feel so great. And some people even, you can do like say food sensitivity testing, they might even have an immune response to ginger. So those are things that, again, it's based on the individual.
Yeah, really cool. So, I mean, the term used for these things is a prokinetic, is that correct?
Yes, okay. Meaning to facilitate movement.
Yeah, kinetics, movement. So yeah, very interesting. So Resilor, is this correct? Resilor is the strongest, right? Because it has two-wave action?
Yeah, I mean, if people want to see it that way, it's just a different mechanism of action. Gotcha. And it's going to create multiple migrating motor complex waves. So say, for example, 1 milligram of Resilor is maybe where people start, or it's been said, you do this with constipation.
Yeah.
Because people with IBS-D might be really scared to have, they hear multiple migrating motor complexes, but sometimes that is the best mechanism for their situation.
Yeah, definitely. And that leads me to another question here is a lot of times people with diarrhea, right? They're wondering, they hear this word prokinetic or, movement, stimulate things, and it's like, oh, that's the last thing they want, right? So do you use prokinetics? Are they used in people with diarrhea? And what's that
Oh,
about? Yeah.
I mean, absolutely. It's about education. It's about explaining it to them. I mean, I go through an extensive intake and kind of try and tell somebody the story back. There's usually examples in their life of me being able to connect the dots for them and say, here's why your migrating motor complex area might need some help. I don't like to say negative words.
Yeah.
And they understand why. And I'm like, this has nothing to do with the way that it comes out of your body.
Yeah.
This is the internal cleaning section that needs help. And then they go, okay. And of course, once they can experience not having loose stool, they're more of a believer as well.
Yeah, exactly. So, I mean, if you get that internal cleaning mechanism working correctly, then it'll, allow, bacteria won't build up as much, right? And then they won't get the gases that promote diarrhea. Is that correct? Or
yeah, exactly.
Yeah. Okay.
Yeah.
So it kind of seems counterintuitive for a lot of people, but it actually helps, right?
Absolutely. Yeah, it can be essential. It's like, well, do I need this, or how long do I need this? That can also be based on the case. For example, someone who has that positive test that we talked about from a food poisoning or traveler's diarrhea, I know that they're now 5 times more likely or more susceptible to another food poisoning. And I know that can be that way for another 5 to 10 years.
Yeah.
So I might be saying to them, look, you might not need this all the time or every night, but perhaps there's going to be periods of stress, period of something where you do notice a shift in your body. So you may want to resume that, making sure your cleaning section is okay.
Yeah. So when people go on Prokinetics, like, what is kind of the recommended timeline? Do you go on them and then you test getting off? How does that kind of work for people?
Right, which is where I would go back to I would say our golden rule for 90 days after you got the negative breath test and or were feeling 75% or more better was when we were waiting for this test, this IBS SMART test specifically. Yeah. Because then we were going to know, because we were always asking Dr. Pimentel, is that at all? Some people seem like they need to go longer. And again, when you note someone's history, you kind of understand why that is, and some people don't want to be on a low dose antibiotic for a long term, so they might rotate them. They might rotate different prokinetic options. And some people, it's like, don't you ever take my Resolor away.
Yeah, exactly. Yeah. So next little topic here is fasting, right? You hear a lot of people talking about either, allowing 4 to 5 hours between meals or even doing intermittent fasting type of thing. Do you recommend this, and do you think it's very important in people who have this issue?
I'm not opposed. Am I recommending it? No.
Yeah.
Because there can be some blood sugar issues having a bacterial or a fungal overgrowth, so there's some things there where I don't want somebody about to tip over. I've seen it, or they're watching the clock. It's got to be 4 hours, or I got to go 5 hours, and they go hypoglycemic. And, so it's a little bit of, again, case by case basis. Can it help? Can you be mindful of it? If you're a person who went from snacking, absolutely, it's going to benefit you to just see, even within, I always give like a 3-day rule, to just start spacing your meals, be mindful of it. And usually it's the gum chewers. Yeah. It's the people who chew gum that go, wow.
Yeah. So basically, if someone doesn't have blood sugar issues and, it can help, right? But it's just important to be careful, right? Because some people, people who do have blood sugar issues, they have to be careful and they have to eat to get the glucose.
Right. What concerns me even more, is if they're on berberine and or cinnamon, which also lower blood sugar, so you have to really take everything into account, because it could really be affecting someone in a way they don't necessarily realize, and they're just trying to do the right thing.
Definitely. So last question here is, what do you, when you're kind of evaluating a patient, and how do you make the decision that you think prokinetics are needed? I know we talked about it a little bit. Maybe their IBS check test, or they show a history of food poisoning. Can we just go over those main kind of factors where someone could really this could be really be helpful for them?
Okay, so main factors, and this came to mind when you asked about the intermittent fasting.
Yeah.
A majority, and this is just what I see, I'm not saying this is everyone, just happens to be what presents to me, is that these people with a history of intermittent fasting often have constipation.
Yeah.
And so to me, that relates, and I won't go there too deeply, but that goes back to the stomach. That's another piece where it's the first part of it, and it could be that a stomach is overproducing more hydrogen that is feeding the methane.
Yeah.
Okay. So I've just seen clinically that when people look at that stomach and they assess that and address it, that they haven't needed any necessary prokinetic agents.
Yeah.
Okay. So coming from that to, okay, we're not evaluating the stomach, or it's a norm, everything is functioning there. Then it really comes to the individual. And of course, I'm really encouraging them to have an expanded diet. So if they're able to have an expanded diet, then we're going to have, hopefully, minimal prokinetic agents. But I do have a few patients where, there's always that how much magnesium are you taking, and or how much could you not take, and how much does, say, Resolor make up for that magnesium that you're now trying to back off of, if that makes sense, okay? So I really am shooting for people to have a daily bowel movement, whatever it takes.
Yeah.
And most people know what works for them best. And then once we've established what that is, I would like them to be able to do less. That's usually the goal. And so you could either be bringing prokinetics on board. So I've seen people, I've been there myself, where I've been on erythromycin, Resolor, ginger, spacing, so some people need multiple things. And then there are people who actually don't need anything. So I know that that's not exactly answering your question as definitively as we would like, but it really can be based on the situation and your tolerance of either the herb or the drug or your access, right?
Definitely.
So but I'm wanting people to be on less things for less amount of time. Okay, I don't like to supplement something forever, so that's what we're looking.
Yeah, definitely, and it just shows us like it's just a complex issue, right? And it's important to kind of work with someone like yourself to, figure out the individual case and see, what's going wrong. So that leads me to, where can people find you if they need help? I've worked with you before. You're awesome. And so what is your site and how can they reach you?
Yes, my site is SIBO Solution, singular, .com. So that's it's a new website, and you can schedule there, have an introductory 15-minute option for people just to talk about their case a little bit and say, does this make sense to you? And that's usually what people are looking for. It's just a connection to someone who understands their history.
Yeah, definitely. Well, that was awesome, and I think people are going to learn, a lot about just, the migrating motor complex and prokinetics, how they may be a useful piece in their treatment puzzle. And thanks so much for coming on to chat, Dr. Keller.
Thank you so much.
Yeah.